Welcome to Kaplan Nursing. This is iHuman Patients virtual simulation. If you have questions after this demonstration, please contact your Kaplan representative or go to i-human.com. Thanks for joining us today. Our speakers today are Dr. Karen Lillyquist. She's an NCLEX instructor here at Kaplan and also a case writer on iHuman Patients. Hallie Benzinger is also joining us. She's a nurse consultant with Kaplan Nursing, and I'm your host, Ann Fry. Today, we're going to talk about our special iHuman Patients solution for this semester, this term, spring of 2020. We're going to talk about the types of cases included. We're going to talk about training and support. We'll do a live demonstration of both the student and instructor side of iHuman, and then we'll talk about implementation. All right, let's talk about our special solution for the current term, the current semester, spring of 2020. So you may need to replace clinical hours with virtual simulation, and that's what this special solution is all about. We're providing 40 cases in 5 specialty areas for you that are assigned and ready to go for your students. This includes reporting and analytics for faculty, training and support for faculty and students. It includes all Kaplan account support that you're accustomed to, as well as an additional layer of iHuman support. The platforms included are Mac, Windows, tablet, and smartphones, and it runs on Chrome, Safari, Firefox, and Microsoft Edge browsers. Now, if you're looking ahead to the fall semester and beyond for that standard iHuman semester-long or term-long case solution, of course, we still have that. But today, we're just talking about the special solution for this half-semester virtual simulation solution. Okay, so for spring of 2020 half-semester special cases, this is the group of cases that are included. There are 40 cases here, and they're listed by specialty group. Now, if you need more detail on any of these cases or all of these cases, please let your Kaplan representative know or go to i-human.com and let us know you'd like to see that detail on each case. I mentioned training and support. This is such an important part of implementing iHuman or any other solution. So for faculty, you have online on-demand videos embedded in iHuman Patients that are easy to access whenever you need them. You also have live online national group training with one of our academic experts. You also have program-specific live online group training for your particular institution, your College of Nursing. And you have that individualized attention of your Kaplan nurse consultant who works with you to implement iHuman Patients in your program. You also have web, chat, email, and phone technical support. For students, you have online on-demand videos embedded right in iHuman Patients where it's easy for them to access and you can easily direct them to those videos. They also have web, chat, email, and phone technical support so that they come to us for all those support needs. Now, when you first get started, you'll begin to meet your iHuman training and support team. You have that Kaplan team that you know, your nurse consultant, your enterprise solution executive, your account managers, your technical support team, but you also have an additional iHuman training and support team of account managers and academic experts. The first thing you'll receive from us when you adopt iHuman Patients is email information that you can easily cut and paste for your students. We'll provide you everything you need to get those students up and running in an easy format, whether you want to push it to them in your LMS or an email, we make that really easy for you. You also have those live or those recorded videos inside of the iHuman Patients platform that you can assign to your students or you can watch yourself. as well as that live faculty online training. And whether you or your students first enter the iHuman Patients platform, the first thing you see is help. So students will really become accustomed to seeing the help icon. It's available throughout the iHuman Patients platform. There's also specific help for undergraduates and faculty, and there's plenty of detail on support so that we're constantly reminding your students to come to us for that technical support and help. And you always see easily accessible ways to get the help you need as well. So just to give you a little bit of background about iHuman Patients, it was founded in 2008, and it's used by healthcare professionals ranging from master clinicians to first-year medical students, as well as advanced practice nursing and physician assistant students. 2 years ago, Kaplan purchased iHuman Patients and adapted the platform to include undergraduate nursing. Over 45 undergraduate nursing cases have been developed so far, and we have 15 additional cases planned for development this year. Now, iHuman Patients undergraduate nursing programs really help prepare your students for next generation NCLEX. And you'll see throughout our live demonstration that the iHuman Patients process aligns with NCSBN's clinical judgment measurement model. So we're going to go ahead and jump right into that live demonstration. Dr. Karen Lilliquist is going to do that for us. We're so thrilled to have her here today. And I'll unshare so that Karen can start up. Thanks, Karen.
Thank you. In this case, Robert Jones, I'll demonstrate some of those key pieces that both you and your students will want to understand as you move forward with your cases. This is meant to augment those training videos that Anne pointed out on the iHuman website. A couple of housekeeping things initially. The hamburger button will allow you to identify some of the specific case instructions. Those will differ with each particular case. You'll see the credits of both the writer and the editor. But here's where your students have, again, access to that help with iHuman and how the product works, so the students can find this information themselves, will help them. They won't have to come to you. We save the case or the student's work every 3 seconds. And so if the student needs to log out to go do something else, they can. And when they restart the case, it will bring them back to when they last completed work. The students also have access to increasing the font if they need, or you can do that simply on your computer by using the control or the command button plus the plus sign. And so here we're working on Robert Jones. He's 52. We have both his height and his weight. And the reason that he's here for an elective total right knee replacement. Notice again that the session is saved automatically as you proceed. Let's begin. This is our landing page. And notice over here to the right, here's that question mark, the help button that Anne was speaking of. So it's readily available. Across the top, we have different tabs. So the electronic health record, the history, the physical, analyze, actions, nursing note. And so with each tab, the student will be asked to complete a particular task. And so within the electronic health record, the history, and the physical, here's where students are asked to recognize key findings. On the left-hand side, there's a clipboard. Here's where the students can write down their notes. As we're moving through the electronic health record, we'll be taking notes because eventually our step within this section is to find the key findings or compare our findings with the expert in a multiple choice question. Initially, we look at the timeline. So Robert was here, admitted yesterday morning at 6 a.m. And we can see that he was admitted for surgery. There was a PACU handoff, admitted to ortho, and each of these are really key areas or designated spots where we'll find care and we'll find an associated note. We assume care at 8 a.m., and that corresponds with the time over here to the left. Next, we have the physician orders. So Dr. Smiley is the orthopod. Robert was here for an elective total right knee replacement. We identify his condition and his code and activity level. Medications are listed, as well as procedures and labs and consultants or consults that were ordered. So physical therapy, occupational therapy, and social work. As we're reading through here, we want to pick up on, again, key findings that will direct our nursing care. So looking at a PT consult, we'll want to make sure we drill down into that a little bit more. With the admitting note, chief complaint, history of present illness, why is Robert getting this knee surgery? Med-surg history, home medications, allergies, family history, social history. Dr. Smiley did a review of systems with Robert. So looking at past medical history and what brought him here. So notice that he has chronic osteoarthritis, mainly to the right knee. So let's add that. Neurologically, there are no concerns. Psychiatrically, no concerns. A physical assessment was completed. And we have our assessment and our plan. So Robert has oxycodone available. Early ambulation is suggested. Again, we see our consults, SCDs, and the social work consult. So what this does is allow the students to read through that electronic health record and really practice focusing on recognizing key findings in relation to care. So we hope that the students are thinking knee surgery, PT, SCDs, enoxaparin. What are we trying to prevent? And what is my care to prevent that from happening or treat it if it does? We're really looking at a DVT here. Progress notes from the healthcare provider. Here we have a description of the operation. Nursing notes. Your students will spend a significant amount of time here, even more for Robert since he's been here for more than 24 hours. Our latest note was 7:30 this morning, and this was the shift handoff. So we learn about his situation, his background. Here's the latest assessment. He's mild risk for pressure injury. There was a physical assessment done. Recommendation, therapy's in there now doing the eval. This is good. SCDs should be on well in bed. And so if your students are looking carefully, they see that mobility, incisions, that's going to be something that we're looking at. Moving down through the nursing notes, SOAP note, another night shift assessment, and here we include a Braden skin assessment as well as a fall scale. And so the students will have access not only to different types of nursing notes, but looking at, again, those key findings. If there's a care plan written, it will be listed here. Here's the medication administration record, all of the medications that were listed in the admitting orders, including the time and the day. And here we can see that the normal saline was started. The calcium carbonate was given prior to admission. The enoxaparin has not yet been given today. And the oxycodone was last given at midnight. PRN medications are listed. So here, oxycodone 5 milligrams was given at 7 a.m. There's ondansetron and Senna. Allied health notes include physical therapy, occupational therapy, speech therapy, case management, social work. So here is our PT eval. Vital signs, they were ordered every 4 hours. And so we, as faculty and students, can look through the trends and identify if anything is abnormal. Intake and output is listed. We can expand those, looking at IV and PO intake, urinary output, and over to the right, we find Robert's weight. Within labs and imaging, your students will find results. So for example, if we look at the basic metabolic panel, We're given not only Robert's values, but what the reference is. And the students can identify if something is abnormal and how is that pertinent to the case. Within imaging, your students will have not only an image to interpret, but also a written interpretation. Now, going through that quickly, I simply listed 3 findings. Your students might find 8 or 10 or 12. It's a matter of just putting their thoughts down on their clipboard, and we'll compare it to the expert. In this step, here's our multiple choice question. So, refused SCDs, I think I saw that. Right total knee arthroplasty, high fall risk, and pain. Let's select those. We compare with the expert. The warnings are stating, are you sure you're ready to move on? And yes, we are. Now, in comparison to the expert, your students not only have a visual finding. So for example, we were correct that he refuses his SCDs. We missed the fact that he needed a walker. We were incorrect that he was a high fall risk. So this visual clue is important, but we don't want the students to stop there. That expert finding feedback is very important. So for each of the key findings, the expert provides the finding as well as where it was located within the electronic health record and information. Now, the information might be content information to provide a foundation for making decisions, but there's also application there as well. Why is that patient refusing SCDs pertinent to Robert's case? So this becomes important in terms of the student's learning. I'm playing this in learning mode, so the students receive feedback with each and every step. Given the fact that I missed needs walker for ambulation, what I can do here is notice that it was found in the nursing notes and the PT notes. Let me close the feedback. I can go back to both the nursing notes or the PT notes and find where was that information. Hopefully by doing that, the students recognize why they missed that key finding, where they focused on something else, or it pushes them to go back and find it so that they can recognize something like that in the future. Now I spent a little bit more on the feedback here. Moving forward, we have the history. And so the history allows the students to ask questions. We gather information in a different manner, and we can validate what we found in the electronic health record. The observations, skin is warm and dry, comes up written. I can close that. But if I need it back, I can see it here. I can hear Robert breathing. If you're students, and we do recommend that they wear earbuds or headphones, they can recognize the sounds from both the history and the physical sections. I'm going to turn that off right now. Here again, we've got our time, but over on the left, this is now the expert key findings from the electronic health record, and that's what we're going to build on. Once again, the student has their clipboard to write the key findings. We can ask Robert questions in 2 different ways. Number 1, we can simply ask, one of our concerns was pain. So if I type in pain, what I can ask is, do you have pain anywhere? Yes, in my leg. Do you have muscle pain or cramping? Yep, in my right calf. Okay, so these are clues. I really want to investigate that right leg. So I might then use my folders that have questions. Under pain complaints, let's select leg pain. And here I can drill down into any additional questions. So for example, what does the pain in your leg feel like? Well, it's more in my calf, not my leg. And we hope the students identify that that's a key finding. They can ask up to 120 questions in this case, and I've asked 3. Maybe I think I'm done. All right, I'm going to put calf pain. But before moving forward, I can select history hints. It says I have to ask at least 5 interview questions before I get a hint. Okay, so I haven't done well at all. I can move down to review of systems. This is a broad approach for the students. I can ask simply general questions, fatigue, difficulty This might give me information about a systemic problem. Robert says no. Maybe I need to drill down with respect to muscle or joint pain, redness or swelling. And Robert says yes. The goal of these review of system questions is maybe on a global sense, allow the students to identify what body system might have concerns and then drill down into those questions specifically. Another area I'll point out to you back up at the top, here's the nurse introductions. How important is that? Hi, I'm your nurse. I'll be taking care of you. I'm here to perform an assessment. And down below, here are your orientation questions. What is your name? What time is it? Where are you? Now, in terms of hints, now I get a little bit more information. I'm still missing 10 key findings, and this will give your students a clue in terms of where those findings might be found. We're going to move forward. I have calf pain listed. Let's compare it to the expert with our multiple choice question. And so I can click on calf pain, calf cramping, and maybe I found that he was nauseated. Compare with my expert. Again, I'm given a visual representation. Oh, we were wrong. He wasn't nauseated, but I'm told that. And then the written feedback. So the students are given information about what questions they missed. And so this was simply a shift assessment. I could follow up on pertinent findings. If it was a new admit, we would do a comprehensive assessment, and your students will get written feedback with that respect, differentiating the two. Here's my missed questions. If I go down further, I can identify what questions did I ask and were they pertinent or not. And then further down, I recognize here my key findings are calf pain and cramping, and expert feedback in terms of how do we assess pain. So more information for your students to build on. The physical section is next. Couple of things here. We can identify what we need to assess by going through the options here. He isn't on a monitor. I don't have airway problems. In terms of lines, well, he does have an IV, so I could select assess the IV site. And in this case, we have to interpret a picture. And so this reflects what a student might see in an actual physical finding. Further down, if we look at dressings, he has a dressing on his right knee following surgery. And for this assessment finding, it's written feedback. So your students will see both. They're asked to select or check his blood pressure. They're asked to get vital signs in terms of temp and respiration. If I wanted respiration, we can move further down, or let's do this. I'm going to check his lungs. So let's auscultate the lungs. I can place my stethoscope, and our system will identify the skill that the student completed. How long did they listen? In what order did they listen? And what were those findings? And so if I'm listening here, I'd like to leave my stethoscope there, right, for listening to both an inhale and an exhale. And once I listen, I can select my key findings, whether it was normal or crackles. We'll just put crackles here. And again, I can listen to the left, and perhaps that's normal. Okay. He had troubles with his calf. So let's quick look there. Let's look under extremities. So visualize and inspect the extremity. The area of redness. Okay, so we had a red calf. Looks like there's some edema. Okay, so if those are my findings, we can compare those with the expert. In this section, we have this head with cogs. This says that we have questions. So let's quickly look at our exercise, and we'll find exercise within any of these areas, whether it be the EHR, the history, the physical. In this question, we're asked to review the MAR and assess the patient. What medications are needed? Well, if I don't remember the MAR, I can actually close this go back to my EHR, close the expert findings, and I can pull my MAR back up if your students need to do that. We looked at that pretty closely. So I'm going to go back to my question here. And what medications are needed? I know that I don't need pain medication because that was given at midnight. He's not nauseated. Let's see, maybe the Dulcosat was needed, the enoxaparin, I think, and the pain has increased, so maybe he needs short acting. I evaluate it and I get expert feedback. 2 were correct, that's good. I missed both the normal saline and the calcium carbonate, and it's telling me that that oxy 5 milligrams was incorrect. And that does make sense. It was given at 7 a.m. I'm not going to give another dose of that medication at 8 because it was ordered every 4 hours. And there's a great explanation with that. For time's sake, we'll move quickly through the other questions. This one asks about personal protective equipment. Well, gloves would be needed. Your students are asked to complete a Braden assessment, so they may have to go through back the history and physical with no risk. And here, we're asked to complete the Morris Fall scale. So again, very low risk. Now, once I complete this, I'm going to compare with my expert. Again, there's that multiple choice question. I have to recognize those cues. So maybe there was pitting edema and pain of that right lower extremity. Compare with my expert, both visual as well as written. Now in these areas, this is where we're recognizing our clues. Let's move forward. Let's now analyze our findings. On the left-hand side, we recognize these are the expert findings, where they were located in the electronic health record, as well as the findings. What we're asked to do is characterize each of the expert findings as to how it might be changing over time. So we're selecting from acute. Acute findings are conditions that have rapid onset and or the treatment or contributing factors that are associated with these conditions. What am I finding right here, right now, that contributes to Robert's problem or my care? Or they might be no change or resolved. Again, your students can review the expert definitions. Refusing the SCDs, that would be acute. A right knee arthroplasty, well, that's why he's here. Needs a walker. Leg pain, that's acute, leg cramping. But here the leg pain that I find in the history is 8 out of 10. I compare that to the electronic health record, 7 out of 10. So this one's worsening. My physical findings were actually all new in terms of redness and warmth, edema, pain, and then a discrepancy in the measurement. So those are all acute. I compare with the expert, and I'm given written feedback. Not only a list of where each item falls, but the definition, as well as some content and application of why it's acute versus worsening for that, for example. Now, once I've identified the problems, once I've characterized the findings, let's identify in terms of concepts. So again, the expert findings, the time course, but now I've asked to identify what concept they fall under. You've got the definition of each of these areas. And so if I'm refusing the SCDs, if I scroll down, let's put that under perfusion. A right total knee arthroplasty, well, that would be activity, rest, and mobility. Now, needing the walker, you might put under mobility, but I think it fits better under safety. Without it, there would be an increased safety or fall risk. And then comfort for pain. And then let's just fill rest of these out for time's sake. Now, if I'm thinking, oh no, that's comfort, that's not right, I can delete it and select something different. Compare with my expert. And so here again, what we're needing to do in this area, we need to prioritize, we need to group, we're analyzing, taking our key findings and saying, how important are they? Do they contribute to my care? What am I trying to prevent or what am I trying to promote? We did well in the items that we labeled. So we are given each of the concepts, the definition, and why each of those key findings fall within that area. And so if your student were to read safety, recognizing that the walker is a good fit under safety. Now we're not through here. We need to prioritize. The prioritization is important. Your students have to identify, what am I going to do first? You may talk about ABCs, Maslow's hierarchy, actual problems versus potential. You've talked about this already with students. Now they have to put it to action. And so if I think about mobility, safety, circulation, or comfort, our circulation will take priority. In this case, we only prioritize one. In other cases, you might prioritize 2, 3, or even 4. We compare with the expert and are given written feedback as far as why is it a priority. Now your students get information about a DVT. So what are the signs and symptoms? What are the complications? Hopefully your student had been thinking about this all along, but here we have both content feedback as well as application. We've prioritized our actions. Now let's look at how do we build our plan of care. So here is the one prioritized category, concept, with the pertinent key findings underneath. Now, with each of these key findings, I may select one action or more, or I may have key findings that have no actions. Specifically, we're looking at perfusion. So if I select on any one of the actions, the care plan library is listed over to the right. A student may simply type in SCDs and come up with actions they could select. Am I going to apply them or not? Or if they need a little bit more help, we can just simply go down to perfusion, that's our area, and maybe we read through these and what would be appropriate. So apply the SCDs, apply a warm compress. So your student might say, okay, well, there is pain with palpation. Maybe I need to put a warm compress, right? And they'll get feedback, is this right or wrong? I have calf cramping. Oh, I should not apply the SCDs. They can educate, they can notify the provider. And so it is important that your students really look at each of these. Once they've selected their actions, let's move forward, compare them with our expert, given written feedback about perfusion, how it's applicable to Robert Jones, and what are those key findings and why. For those students that are visual learners, we have feedback in terms of actions, well, here, that I should have selected and missed, and actions I did, but the expert did not. It doesn't mean that they're wrong, it just wasn't something the expert focused on. Last, just like we prioritized our key areas, our concepts, we prioritize our actions. Is it stat? It needs to be done within 15 minutes. Is it urgent? It needs to be done within a couple of hours. Or routine, it can wait until the end of the shift. So notifying about unanticipated peripheral edema, maybe that's urgent. Elevate the affected extremity, urgent. Instruct to call immediately if shortness of breath, perhaps that's stat. So we're going to label those, compare them with the expert. Again, both visual and written feedback. It's important the students recognize where they went wrong. It's a great learning opportunity, and the expert will provide that feedback in terms of why would it be stat versus urgent, or vice versa. Last is the nursing note. So here's where the student has an opportunity to write out their findings. Now, as faculty, you can decide, are they going to write out an assessment? Maybe they're writing out a SOAP note for a particular finding. Maybe it's an SBAR. You'd like them to practice calling that provider or reporting off to another nurse. Here's where you can make this individualized to your class, perhaps reflecting on learning objectives for that clinical course, perhaps focusing on what you spoke about in lecture that day. The key findings of the expert are over here to the left, because of course we want to bring them forward into our note. We then compared with the expert. In this case, the expert felt that an S-bar to Dr. Smiley was pertinent, just simply given the acute changes within the last half hour. Now the students, once they're complete, they can submit, and we've got some feedback here. Patient outcome will tell you what was the next step with Mr. Jones. He received heparin and then has been ambulating down the hallway. Here are the learning outcomes. Now the learning outcomes are identified for each of our cases. And so oftentimes faculty will ask, how do I help my student prepare for this simulation? They can look at the learning outcomes, and then here are our references that were used to create the case. You may want to assign some of these to have your students read before they come to simulation or complete the simulation, and that will give them that feedback. Notice that there are textbooks as well as CUSIN competencies. They're all included with those cases. The feedback includes nursing pearls, so here's additional information on DVTs, and then also the pharmacology that was included. Any of those multiple choice questions within each section are listed, so the student will get feedback specifically on how they did on those questions. And the last piece that I'll point out is the students receive an evaluation. And what they'll find here is within each of these pertinent areas. So for example, electronic health record, history, I received a percent back. So I did 67% with the EHR. Well, that wasn't so bad, right? 38% with history. That was not good. But I can drill into that and say, okay, what did I miss? It will expand to what was that multiple choice question. I can see those findings as well as identify each of the questions I did ask and each that I missed. So that becomes important in terms of feedback for your students. Now the cases themselves, the students can play one time, just as we would if we were at a clinical. We have one chance with our patient. If you were to review a case, you can play that multiple times. Robert Jones is our case, our practice case, so you can play this multiple times. Each of these areas are great to include in your debrief. Simulation, a big part of that is not only the case, but what is that discussion you have before and after? These are perfect areas to bring forward to talk with your students in terms of, well, what did you miss? And tell me more about why that was important. Or you asked questions that weren't required, okay? And what were you looking for? So bring that forward within your debrief. And then there is additional reporting for faculty. And so I'll stop sharing and we can talk a little bit more about that.
Thank you so much, Dr. Lilliquist. I will go on and share again my screen, and I'm going to actually share the faculty side of iHuman Patients. So I'm in the faculty side. You can see across the top of my screen are various tabs. Both faculty and students have the Case Attempts tab, where we can see all the cases available. You as faculty have a lot more here than the students do. And to go back and review a case, we can just play that case in review mode. As Dr. Lilliquist said, we can, as faculty, can play that case repeatedly and we can review it. So here I am back in that case we just looked at. I can review all aspects of it and I can look at that summary. So I'd like to bring Hallie Benzinger, our nurse consultant, into the conversation right now because she's got great resources on how you might pre-brief and debrief these types of cases. And PN versus RN, what can you do with your RN students versus an LPN or LVN student? So Hallie, as we're kind of looking at this summary, what are your recommendations about pre-brief and debrief with your students?
Thanks, Anne. I appreciate your time. Welcome, faculty. With the case studies, they are equivalent to about 2.5 hours that it will take the students to do the clinical portion. However, your pre-briefing and your debriefing can also be included in those. You may want to check with your state boards of nursing to determine what is acceptable for pre-briefing. Debriefing is normally accepted in simulation cases, but with the pre-briefing, just like Karen was talking about, you can have your students go in and read those articles from the references. You may have them go out and search for videos that are pertinent to the case. So if you know that you're taking care of this person who's had a knee replacement, you may have them go out and look for videos for post-operative care, for example. We provide a threshold score for your students, but your nurse consultant will work with you to determine what is best for your students as far as a passing score. And that's part of my job, is to help you with that. And I also help you thread cases throughout your curriculum. For the PN versus RN, these cases are applicable for both. For the PN students, they are going to get a, it's called phase 1. So with phase 1, students will actually get to go through the electronic medical record, perform a history and a physical. And that's the phase 1 or part 1 for PN students. For the RN students, they will continue on through the case to do analysis, take action, and evaluate their cases for that. They'll also go through the summary and they'll create nurses' notes, which can be either an SBAR or nurses' notes or SOAP notes. It's whatever the faculty determines is appropriate for their students.
Oh, that's great. Thank you so much, Hallie. That is really good information for us.
Sure.
So lots of things you can do with this as faculty members. Again, I've just kind of reviewed this case from my case attempts area. Now, another important area for faculty is the assignments tab. This is where you can see all the cases that you've assigned, and you can go back and look at reports on them. So if I want to see an online report on a case, I can show it with names or without. So perhaps I want to be able to show this reporting to a whole cohort of students and kind of talk through this perhaps in my debrief. I can also download it as an Excel file. So if I'm looking at it as an online report, first I can see a dashboard, just a quick overview of how my students did. So immediately going into my online report, seeing my dashboard, I know right away as a faculty member that 104 of my 114 students in this cohort have started and done this case. They've completed it. I've got 1 who hasn't completed and 9 who haven't started. Also, right here on my dashboard, I can see their performance by case section and their overall performance. So I'll bring Hallie in about this again, because performance scores are really clear to you. You know your students best, so you can see how they're performing. For example, here in the history, these students' performance is really ranging all the way from 20% up to 75% or so. And there's a pretty large distribution over that whole period. So Hallie, would love to hear from you what you think about scoring your students on iHuman cases.
Excellent. So we place our threshold at about 63.8 to 64% is considered passing. When you are debriefing your students, you can bring up these reports, and there are some other reports that drill down even further into the types of questions that were asked, how many questions were asked in the history, as well as how many physical assessments were performed, et cetera, et cetera. And this is really important because we all know we have those that will click and click and click. And so when you bring this information up anonymously, then it's going to be easy for the class to see, well, you know, this one student got 100%, but to get the 5 questions they were supposed to ask, but they asked 115 questions. So, that's kind of obvious what they're doing, and this helps the students, holds them more accountable. You can also go through and see which questions were missed, highly missed. Perhaps your students forgot to wash their hands. So this is something that you can bring up in the debrief and say, okay, guys, you forgot, a lot of you are forgetting to wash your hands. Let's talk about that and what's the importance of that and when would you do that? And so these things are very beneficial. These reports are phenomenal. You're going to get even more detailed reports than this, but they're an excellent source to figure out where your students are as a cohort and then also where they are individually. You can actually see where their thinking is. So if they ask a particular question that was not really relevant or that the expert didn't pick out, but several of them picked it, you can say, well, gosh, y'all, I see that you chose to ask the patient this. What were you thinking when you did that? I'm not saying it's wrong, but let's talk about what led you to that decision. So you can actually see where their thinking is. It's just a phenomenal tool, and it's like they have an instructor sitting on their shoulder, and you're actually bringing clinical to the student.
Thanks so much, Hallie. That is great commentary about how you as faculty can use these reports. So as Hallie's been talking, I've been showing you some of these reports in your dashboard and how you can utilize them. One thing we haven't talked about yet in the dashboard is the group case play time. So again, this helps you know your students even better than you already do, because you can see how long your students are spending in these cases. You know, Hallie mentioned that these cases usually take about 2.5 hours to complete. You can see for your students, how long is it taking for them to complete these cases? And where are they struggling, perhaps, or where are they lingering? Hallie mentioned, you know, sometimes students might ask a whole lot of questions in the history. Well, here I've got a student who spent 2 hours and 6 minutes in the history. Why is that? Let me dig in on that a little bit. So I can kind of see, I can spot those problem areas quickly in the dashboard, but I also have summary reports and reports on the multiple choice questions and exercises. So in the summary report, I can see really quickly things like frequently missed tasks across categories or extraneous tasks that my students did. I can also see individual performance across all the categories. So again, this will help me direct my students and help them. If I'm showing this in class, I may not want to have their usernames there, so I would have selected to show this without usernames. If I do want to look at this with an individual student, I can just dig right in to their account and see all that detail and talk about those questions with them specifically. Now, if you need to utilize reporting that you're going to export to others, or if you just want to grade your nurse notes really quickly, you can utilize the Excel report. So all the information we've been looking at is also available in an Excel report. So if you're an Excel person, this is great for you because you can see all the categories, you can sort and filter and get to where you need to go. Another thing that this report is fantastic for, this Excel sheet, is that you can grade your nurse's notes right here on one page. Instead of going through your interface, you can just look right here, quickly glance through those nurses' notes, see how your students did. So all the reporting features are really intended to help you get a quick bead on how your students are doing and then dig in on the individual information. So I have a lot of detail here as well as an overview. Okay, so we've covered reports in a lot of detail. Thanks so much for taking a look at this with us. I'm going to go ahead and go back to our PowerPoint slideshow and say thank you to everyone. We really do appreciate your time today. One last thing I want to leave you with before you go is I want to make sure you understand the depth of support that we have for you. So as we've been talking today, we've talked with Dr. Karen Lilliquist, who's an academic expert walking you through iHuman patients, and we've talked with Hallie Benzinger, our nurse consultant. So I would like to just turn it over to Hallie for just a minute to talk briefly about how our nursing consultant team works with you to implement our solutions in your programs. So Hallie, I'll turn it over to you.
Thanks, Ann. So your nurse consultant, my job is to assist faculty and hold your hand through this whole process. We understand that things are overwhelming right now. And I help you with implementing this throughout your program and helping you get your students up to speed. We have the whole team that assists. You are not alone in this, and I will help you, again, thread this through your curriculum. So generally, I help with mapping of the course or of the virtual patients throughout your curriculum so that we can meet your needs and meet those students' needs. You can reach out to anyone on the team. You have an entire team taking care of you when you become part of the Kaplan family.
Thanks so much, Hallie. And again, everyone, we appreciate your time today. Thank you for all you do. And this concludes our session. Have a great day, everyone.